repealed.
Here to discuss that topic, the author of the Obamacare Survival Guide and our very own deputy health editor here at Newsmax, Nick Tate. Nick, we welcome you back to America's Forum.
Good to be here.
Now, during my days in Congress, we had various alternatives to plans put forth by Democratic presidents. But as so often is the case, for whatever reason, Republican alternative plans are not really highlighted. But you've got what might be in store as a replacement or a substitute for Obamacare.
Well, you know, one of the criticisms that the Obamacare advocates have leveled against Republicans is they don't have any ideas of their own. You know, the GOP is the party of no, they just want to repeal Obamacare, but that's simply not true. There have been a number of good ideas that have been floated, and in fact, earlier this year, Senate Republicans put together a piece of legislation that codifies and collects some of the best ideas. And what's interesting is that as we move forward with the repeal effort, if it happens, or the Supreme Court deciding to strike down aspects of Obamacare, I think we're going to see many of those ideas become front and center in the discussion of how do we fix this law.
So, Nick, what do you think is likely? Do you think if Obamacare is repealed, they would enact this in its current state, or do you think it would be kind of piecemealed in and maybe married together? How do you see this playing out?
Hard to predict, but you know, we've seen 52 efforts by the House to repeal Obamacare outright. Those repeal votes are not going to go anywhere as long as we have the president in the White House. My guess is we'll get one more repeal effort to allow the new members of Congress to vote and get on the record against it, but then we'll see some of these issues taken up either in piecemeal or as this alternative bill.
And speaking of those issues, with 2 minutes and 30 seconds remaining in this segment, although we're keeping you around to talk more, can you highlight the big areas where the Republicans have their alternatives set?
Sure. There are really three key areas where the Republican alternatives really do pick up some of the aspects of the Affordable Care Act that people like, the goals of the law, and preserve them. They may fund them a little differently and come at them a little differently, but beginning with the subsidies. Under the Republican alternative, Americans who need help with their health insurance, who buy it on their own, would still get federal subsidies. They're not as generous as the Obamacare subsidies. It's about 3 times the poverty level. If you're earning that much, you would still get a subsidy. So that's number one. Number two would be the preservation of pre-existing conditions coverage. If you have a pre-existing condition, and before the Affordable Care Act, you could not get insurance or it would cost you a lot. Under the Republican alternative, you would be able to get insurance if you have a pre-existing condition as long as you continue to have insurance over time. So if you lost your job and you bought it on your own, you would still be able to get insurance. The third key aspect is in the reform of Medicaid. Medicaid is a big budget eater for most states, and under Obamacare there's just simply a plan that requires it to be expanded and eligibility guidelines to be raised. Under the Republican alternative, states would get a per capita amount of money for each state individual who qualifies for Medicaid, and then it would be up to the states to decide how best to spend that money. They could privatize it, they could move toward an HMO model like we're trying to do in Florida, they could charge co-pays like they're trying to do in Illinois. Arkansas has experimented, and so the Republican plan is really intended to expand access, expand coverage, and do it in a way that's more cost effective than this enormously costly Obamacare law.
Okay, we've only got about a minute left, but what happens with the uninsured? Under Obamacare, everyone is supposed to have insurance. Under the new plan, that's not the, do the taxpayers take care of the uninsured?
Well, the uninsured would be picked up through Medicaid, which is largely federally funded. What would go away under the alternative, GOP alternative, would be the individual mandate requiring people to have insurance, and the employer mandate compelling employers to provide health benefits or pay a fine. But Medicaid would cover those folks who are on the poor end of the scale. It would pick them up. It's changed slightly from the alternative. The GOP plan is different from Obamacare, but those folks would still be covered.
Okay.
And a 4-letter word alert, really 2 of them, cost, C-O-S-T, and time, T-I-M-E. Those 2 4-letter words play a part here. Out of time now, but back with Nick to talk about cost